Hi, good morning, Arthur. My name is Phoebe Cox. I'm your invigilator for the OET speaking session on the 15th of March 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you say your full name for the record, please?
My full name is Arthur Russell.
And what is your candidate number, please?
My candidate number is 231002421.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What do you do when entering a patient's room?
First, I knock to let the patient know I am at the door. Initially, I'd introduce myself and try to find something in common with the patient so we can get to know each other. I always greet the patient and ask if they need anything, even if they aren't capable of responding.
How do you handle ethical or philosophical differences with the patient?
When I feel judgment or disapproval welling up inside me, I do a quick mental inventory and check in. It doesn't happen often, but I would not be human if I said it never has or will again. I don't know why the person made the choices they made, or what led up to it. I only know that my job is to help them, and I stay focused on that. I've worked with drug addicts and criminals, but my job is to be kind, provide excellent care, and maybe even learn something from them.
How would you handle it if a patient refuses care?
If a patient refuses care, I'd find out why. I'd take the time to talk to them, to make sure they realize I'm here to help them, and that I only want what's best for them. I've found that treating people with respect and dignity goes a long way in earning trust. Once they trust you, they will listen to you.
Can you think of an experience in which a patient's care was considerably different because of your close monitoring?
I was assisting with surgery and I noticed some irregular heart rhythm on the monitor. Due to my preoperative care and communication with the patient, I knew that the patient had heart issues in his history and that it was important to take care of the issue right away. I administered medication to help regulate it, and the rest of the surgery went along without any problems.
Talk about a time when you handled a high-stress situation calmly and effectively.
I was working a shift during which we were short-staffed and had a high volume of scheduled surgeries. I had to assist with multiple surgeries at the same time, which was very stressful. I kept an open line of communication going with the doctors and focused on staying detail-oriented and focused on each surgery at hand. It was a long day, but everything went smoothly.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients or perhaps a relative and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hi, good morning. My name is Arthur Russell. I'm one of the registered nurses working in this hospital.
Good morning, nurse.
For confirmation, may I know your full name, please?
My full name is Phoebe Cox.
Thank you, Phoebe, for the confirmation. Your surgery for hernia repair has been scheduled 2 months after. Am I right?
Yes, nurse.
Okay, so do you know anything regarding your surgery?
Not really.
Don't worry, I can explain it to you. Hernia repair surgery is usually performed under general anesthesia, so before the surgery, you will have an evaluation of your general state of health, including a history, physical exam, and possibly lab work, and an electrocardiogram, ECG.
All right.
Another important factor is smoking. May I know if you have any smoking habits?
Yes, I do.
All right. If you don't mind, can you please tell me how frequently you smoke?
Well, I can say that I smoke around 20 to 30 cigarettes in a day.
Oh, I see. It's quite a high number. I recommend you to quit smoking completely, at least 4 weeks before the surgery.
But I can't understand how smoking and hernia repair surgery is correlated.
I can explain it to you, Phoebe.
You may please.
Smoking tobacco puts you at a greatly increased risk for complications after surgery. This includes heart and lung damage, poor wound healing, and a higher chance of complications. However, quitting smoking, even as late as 4 weeks before the surgery, improves the chances of having a good post-operative result and fewer complications.
Is it?
Yes. Moreover, anesthesia is also likely to be less complicated in smokers who have quit, compared to those who are still smoking. In fact, even children who breathe in secondhand smoke have a higher frequency of lung complications after anesthesia.
Oh, it's a new piece of information to me.
You should also know that almost 20% improvement in health outcomes with each week a smoker is off tobacco. It is because of the resulting improvement in the blood circulation, and especially to heart, kidney, lungs, liver, and spleen.
Oh, I see.
Yes, overall, the effects of smoking cessation show a 40% reduction in complications. And, specifically, a 43% reduction in poor wound healing.
Okay. But quitting smoking will not be easy, I think.
It might be for some. Perhaps, there are some ways to support you in the mission to quit smoking. There are some programs designed to help to quit smoking. It include high-intensity behavioral interventions, such as contact with support staff on a weekly basis. Using nicotine, or other medicated patches to reduce nicotine cravings, electronic cigarette, nicotine gums, which are now easily available in the market. And also a hotline for telephone support.
That's great.
If you are ready to adopt such interventions, at least 4 weeks before planned surgery, then, the post-operative course would be much smoother. Moreover, such interventions produce tangible impact within a week.
All right. I understand the necessity of quitting smoking. I'll try my level best.
I am glad to hear that. However, first and foremost is your own efforts. Avoid situations that provoke cigarette smoking in you. For example, partying, gathering with smoking partners, club visits, etc. Also, if possible, inform your friends and family members about this. And convey them to support you in the mission quit smoking. And instruct them to make sure you don't smoke under any circumstances.
I think that is a good idea. Support of family and friends will make a greater impact.
Yes, it is. Also, all the support you need will be provided by us to our maximum extent.
Thank you, nurse.
All the very best. See you for the physical examination and tests prior to the surgery.
Sure, nurse. That is the end of your OIT speaking roleplay. All the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.